Good evening, everyone, and thank you for joining us tonight for the Burnout, What to Look Out For and What to Do with Dr. Jo Braid. My name is Lauren Thomas and I am the CPD Program Officer with Central and Eastern Sydney PHN. I would firstly like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise a continuing connection to land, water and community and pay respect to elders past, present and emerging. I also extend that respect to Aboriginal colleagues joining us tonight. Just some housekeeping, we'll have an evaluation survey at the end, which will be emailed to you and put into the chat. We really appreciate any feedback you can give us, and this will allow us to issue your certificates of attendance. For any GPs also who are joining us this evening, this activity is a self-report activity, so you'll be able to upload the hours to your RSCGP dashboard. We will be having some questions through the Q&A box. Also just a little bit differently tonight, as Jo likes to have a bit of interactivity with participants. If you wish to actually come off mute, if you use the little raise hand functionality, we can unmute you, but please note that we are recording this session as well. I'd like to draw your attention to some of our upcoming events in the next week or so and in August. Please register via our website. We also have some CPR courses that run usually the first Monday of each month. So if you'd like to attend, please see our website for more details. And now I would just like to introduce Dr. Jo Braid, who will be doing the talk tonight. She's a rehabilitation specialist and burnout coach based in Orange, New South Wales. Thanks, Jo.
Great, thank you very much, Lauren, and lovely to have so many people registered for the event this evening. I'm going to go ahead and share my screen and get started. So I am radioing in from Orange at the moment, and that's where I live with my family here, and I'm a rehabilitation physician of over 10 years now, nearly 15 years, and I work with the Midwestern Brain Injury Rehabilitation Program, which is based out of Bathurst. That's my part-time clinical work, and the rest of the time I coach mainly healthcare professionals, usually individually and also in a group coaching format as well. So it's I originally came from the UK and moved to Australia after medical school, and over the last year, I've been a lucky recipient of the Australian Clinical Entrepreneur Program that some of you might have heard of. And that has been really great for upskilling in sort of entrepreneurial health innovation skills and growing a network of like-minded individuals across Australia. I love playing tennis, and that's what I like to do if I'm not doing clinical work or coaching. I've got 3 young sons who are in primary school and my husband here somewhere in the background. Let's get started. So today I'm going to do an overview around burnout. I'm going to talk about the ways that you might notice it in yourself, in a colleague, or even in a patient. Let's look into why burnout shows up. I've got 2 different rating tools that can sort of rate the severity of burnout. I've got more than 3 tools that we can use to address burnout, and I will definitely be leaving you with resources that you might like to use towards the end of the presentation tonight. Okay, so burnout has got 3 main factors to it. It was drawn up in 1975, and it was related to professionals who have a caring role. The 3 main areas that are commonly discussed are a state of physical, mental, or most commonly emotional exhaustion. So emotional exhaustion is when you sort of have these pervasive, heavy emotions that keep on getting they keep on returning, they keep on recurring, often based upon the situation that you're in a combination with your some personality sort of types that you might have. One may feel an increased mental distance from one's job. So you're just checking out a little bit. You're not as involved. You're not as engaged with patients. You may be dropping your empathy that you once had a lot of earlier. You might have feelings of cynicism related to your job, that you're not making a difference. You're no longer enjoying this career that you've trained for years in a competitive nature to get into. And finally, you might have a sense of reduced professional efficacy. So what does that mean? That means you're just not got the same kind of level of output that you might have had before. So often people who end up getting burnout are problem solvers, they're fixers, they're type A personalities, they're the go-to person to get things sorted out, and they have high standards for themselves and high expectations of what they're capable of doing, and they're just not cutting it as well as they might have done before they trended in that sort of insidious way towards burnout. Okay, so there are two extra symptoms that I wanted to talk about as well that have been particularly discussed by the group. Gordon Parker, he's a professor at Sydney University, I believe. They've talked about also cognitive dysfunction. So when we're seeing that our executive function is not working as well as it has been. So getting distracted, finding it hard to focus on tasks. People do talk about having a sense of brain fog. So that might be relatable. You might sort of go, oh yeah, I do get distracted. I find it hard to concentrate on what I'm meant to be getting through. And finally, insularity is another symptom that we might notice in people in burnout, where people withdraw from the engagement with others. The relationships that they had with others are not as strong as they were before. They're maybe giving less or less involved, less less connection with others around them. So that can be in the workplace, and you might notice somebody in work sort of withdrawing, or you might notice it in a partner. And sort of see that change in them and go, oh, something's not quite how you used to be. So what I'd like to do, we've gone through the 5 most common symptoms that you might notice in somebody in burnout. I'd love to do a poll across the audience who we've got here tonight, and hopefully most people are here and have joined with us. So Lauren, thank you for popping up the poll. If you're comfortable, this is going to be anonymous. I'd love for the attendees, please, to just note whether or not you have experienced any of these symptoms of burnout. So it could be a 0 if you've never experienced any of them, 1, 2, 3, 4, or 5 if you have experienced all 5 of these symptoms sort of in a cluster in a time together. So let's go ahead with the poll. And I can't actually see the poll at the moment, so why don't we have you guys answering the poll, and then we'll look at the results towards the end when we have some time for Q&A at the end. Okay, so just noting out of those 5 symptoms, whether or not you've experienced any of them before. So, thank you. So here we go, we're getting the answers coming through. And yeah, so most common is 3 out of 5. In fact, 3 out of 5 symptoms have been commonly rated by those who've answered in the polls today. Thank you. Okay, great. All right. So thanks so much for responding. We'll end the poll now and we'll keep going with the talk. Okay, so let's talk now about how common burnout can be. And you might know that with friends and colleagues in your workplace or people you've talked to recently. In a study in the US in 2021, they found that 63% of physicians had at least one manifestation of burnout. So what do they mean with that? They mean either the emotional exhaustion, cynicism, or decreased productivity. And what is the outcome when we have staff members who are showing at least just one manifestation of burnout? It's associated with quality of care. So patients realize that their doctor is not engaging with them in the same way that they used to. Physician turnover, a very expensive part of, what, like any healthcare profession, turnover or attrition can be very expensive for the healthcare workforce. It's tricky to sort of fill those spaces and upskill people to come back into the workforce and replace people, and reductions in work effort. So less work is kind of getting done, and that decreased personal productivity, what people might imagine in themselves, that may actually be relating to sort of presenteeism, when people are at work and they're just not as productive as they used to once be. So that's come out from the Mayo Clinic. Dr. Tate Shanafelt is a great guru in this sort of area of research. He's actually coming to Sydney in the second week of September, and he's talking about organisational workforce wellbeing, and I'm looking forward to heading into the city to attend that. Okay, so here we go into what you might notice about somebody or yourself who is showing some burnout symptoms. So we've got these three different areas. We've got physical, we've got behavioural, and we've got emotional symptoms that you might notice. So this is when I often ask for sort of the interactive part happening in the talk, but I think I'll just keep going through, and let's answer some questions at the end when we don't have the slides up. Okay, so going through physical symptoms, let's have a think about what you might notice in somebody in burnout physically, because burnout is often an outcome from continued stress in a certain environment, and so after a while you might notice it manifesting with some physical changes. So you might hear about headaches, you might have stomach aches, changes in your gut, fatigue, definitely. Often people are really tired, really exhausted with this. You've sort of probably had a high cortisol level for a while, and then that will be bottoming out, and you've probably got a low cortisol level if we look at the physiology behind this, and immune function is not working as well as it might have done before, and illnesses are on the rise. There can be a change in appetite and certainly a change in sleep as well. So that's the mainstay of the physical symptoms you might notice. Let's go on to the emotional symptoms. So these are also included in some of that definition around burnout. You've got that cynicism, that indifference to what the outcome is and what's happening here. Also a sense of helplessness or despair. People with burnout have these high expectations of themselves, and they just feel like they're failing, or their self-esteem drops right down, and that sort of self-doubt, can I do this? I don't even want to try because I'm worried about failing, may come in as well. They definitely lose that satisfaction and that sort of joy and joie de vivre that they had behind their role, often their workplace role. We've got this insularity coming up with feeling detached or alone in the world, and really that motivation to do things really drops away. So those are some of the emotional symptoms. I just don't want to do this anymore. And I'm going to talk to you about how burnout differs from depression, because there is some overlay there, and I'm going to talk about that shortly. Okay. So let's go down to behavioural signs. So you might see that there's that reduced performance in everyday tasks. They withdraw, they're more isolated. There maybe is some procrastination on getting things done. They may be actually quite irritable and reactive and have unexpected outbursts that you might not notice in that person. And there can definitely be use of substances to cope with what's going on for them. You know, that can be a whole range of things, legal, illegal, online, etc., etc. Okay, so those are some of the behavioural signs that you might notice. Okay, so we've gone through, you know, the definition of burnout. We've done a little poll on what number of symptoms you might have noticed in yourself. Now we've gone through the physical, emotional, and behavioural signs and symptoms that you might notice in yourself or somebody else who might be at risk of burnout. Let's think about what are the contributing factors towards somebody developing burnout. Okay, so there's three main areas that I'm going to talk about here as well. Firstly, work-related. You might be aware of the psychosocial workplace hazards and risk factors that has been actually put into legislation as of the 1st of April here in Australia. So you'll be aware that we have physical work hazards, sort of how to lift things safely and how much one person should lift, for example. Now we have a list of psychosocial workplace hazards because it's become aware to, I guess, the insurers and that and work cover and that, the risks in some workplaces for people to have a psychosocial consequence of having little or no control over their job, having lack of recognition. So it's only sort of turning up and doing your work and you know, I'm not voting that everybody looks for external validation on everything that they do, but to not get any recognition for the day in, day out, on call, etc., that your role has, that can be a contributor towards those psychosocial workplace hazards. Having a very, very demanding job expectations, being in an unchallenging or sort of monotonous role, or the flip side being a very chaotic or high pressure environment. And as healthcare professionals on this call, some of this may seem quite relatable and recognizable in your workplaces too. So what goes on in work contributes to the risk of developing burnout, but I hope that you would all agree with me on the call. My vote on, is the workplace 100% responsible? I'd say no. Otherwise, all of those of us who go into a workplace would be likely to get burnout. And we know that it's certainly not 100% of people who get burnt out at work. So those are the work related contributing factors. Now we're going to go into lifestyle related contributing factors. So again, how many hours of the week are you working? How much control do you have over that? I'm not going to qualify or quantify what working too much is. That's on an individual basis. How are the connecting times? So how much can you socialize and how much can you relax as well? And, you know, post-pandemic, it's been that very much hybrid model where there's things at work, there's things at work that come home with you, there's the demands of those that you might be caring for as well, and coming up for air, having a break can often be really challenging with a lot on one's plate. How are your supportive relationships? You know, we know that social connections have a greater health benefit than, or they have a more detrimental health effect than smoking or alcohol consumption. Some things that we would maybe think are really bad for us, actually being socially isolated is much worse for us health-wise, and there's plenty of published evidence on that. A lot's come out from Queensland on that. I referred to this earlier. What are your responsibilities like, and where do you have help for some of those responsibilities? And sleep. I'm sure everybody on the call probably talks with their patients about sleep and how's it working out for you. Finally, we're going to talk about personality traits. I'm not saying these in sort of a diagnostic fashion. This is not a psychiatric assessment here at all. It's just some of those traits that you might have. So perfectionist tendencies, people who struggle with doing things imperfectly and really want it to be perfect. So when do you know that you're actually finished with a task that you need to do? Sometimes there's that endless horizon, and how are you ever going to get to that point where it's complete and it's finished? Also having a pessimistic view of yourself and the world, very much needing to be in control. There are only certain things that we can really truly be in control of, and I would say a lot of that actually is to do with how we show up and who we are in the world. And finally, being very high achieving in nature, which so many healthcare professionals are, having that grit and tenacity to get through all the hoops that we have to get through, and to continue practicing at a good level takes often a lot of that high achieving, ambitious drive. Okay, so I'm now going to go through the difference between burnout and depression, because I think that's a question that often comes up in this talk. So when we're looking at burnout versus depression, and we're assessing around burnout, remember it's not like a diagnostic condition. So we haven't actually necessarily learned about this in our healthcare training, particularly in medical training. We don't learn about this as something that meets criteria for a diagnosis, but depression we do. Depressive symptoms do feature in assessments that we have for burnout. There's not one main burnout assessment tool that we might use. There's a handful of different ones that you might use. In burnout, we might notice that somebody has an apathy, but they do continue to function, and the apathy is often work-related. So there's a specific sort of cynicism, perceived decreased productivity around how they're showing up in the workplace, because that is usually the environment that is the main trigger and the source of stress or the stressor for them. When we look at burnout compared to depression, depression is generally more global, it feels heavier, it actually feels bleaker in a more pervasive sort of nature, and there's a real pit of desperation there. So I would say that with the clients that I work with as a coach, I do not have my medical hat on at all when I am coaching, but I will ensure that people have seen their GP recently or a healthcare provider recently who can check through that essentially things are going okay on a health check for them, because that's not within my scope of practice as a coach. And if it seems like something's getting out of scope of practice, I will definitely refer on. Some people do have psychology in tandem with having coaching. Okay, so now let's find out some ways as to how we can rate burnout. So here on this QR code, I have got a tool which is out of Belgium. It's from 2019, and they looked at individuals in the Netherlands and also Belgium and drew up this shorter version. They have two burnout assessment tools. One is with 12 work-related questions, and I've drawn that up on an online form. You fill out the 12 questions that relate to how you're feeling, how you're showing up in the workplace, what's more challenging for you, and based on those answers, whether that happens sort of never, rarely, sometimes, often, or always, you get a score, and that will give you a risk of burnout. So again, this is like a severity measure. There is no formal cutoff as to whether you meet like a criteria for having burnout or not. So that's one tool you can use. And I would like to share another tool. There's one here, which again is from this book, Burnout, by Professor Gordon Parker. This is 34 questions, looking into different burnout symptom clusters. So some overlap with that other burnout assessment tool. This one is not available on this presentation. You've actually got to look in the back of the book here, and you'll be able to see the questions in there and see how that relates to other studies they've done of about 650 people and looking at what were the most common scores and where you might lie there. So certainly exhaustion is generally the highest, most common score, followed by cognitive symptoms and withdrawal and insularity. Okay, so that's two different ways to rate burnout. Again, it's just a measure of risk factor rather than a definitive cutoff, and you definitely have burnout. Okay, so now I'm going to go through 3 ways to reduce your risk of burnout, and certainly I've got a few extra bonus ones that I'm going to add in here. Certainly 2 out of the 4 that I'm going to share with you do have evidence behind them. So the first one we're going to talk about is identifying what is meaningful to you. Again, from the work of Dr. Tate Shanafelt at the Mayo Clinic in a much earlier work that he did in 2009. He and his team found, amongst looking at academic faculty, that doctors spending less than 20% of their time doing meaningful activities have a greater than 50% risk of burnout. So what is a meaningful activity? This is really up to you, and it's very individual in nature. And I think that ties in with the fact that burnout recovery, burnout management is almost something that needs to be self-directed, because what is meaningful to you might not be meaningful to the person next to you. And I don't think there's a cookie cutter sort of one size fits all solution to burnout recovery. So I encourage you now to think about what is meaningful to you. And if you feel comfortable and you'd like to share, give us an idea of what is meaningful to you in the chat, please. And there might be others that can relate to that. There might be others that have a different idea of what is meaningful. Because I also am aware that resentment is another emotion that comes up in people who experience burnout. And the resentment can often be triggered by doing things that don't matter to you. So matter and meaningful, similar kind of overlap there. And if you're not really getting that chance to do things that are meaningful to you, you might be having that feeling of resentment and why am I continuing to do this, and maybe ending up in burnout there. So thank you. Somebody's got going in the chat. Let's see, what is meaningful to you in the workplace? Yes, going to the gym, going for a walk, meeting up with old friends. Fantastic. So let's try and tailor those answers to what's meaningful to you in the workplace. Some examples I've had from previous audiences, for example, coaching, doing the focusing more on my actual job than doing admin work. So in ED, I've asked this question, and some doctors absolutely love doing procedures, and that really feels very satisfying to them, and they like to get in some procedure that is not what I do because I'm at rehab at the other end of the hospital. Other doctors in emergency like to get to the bottom of the diagnosis while the patient was still in the emergency department, and that was really meaningful to them. So they'd put their puzzle pieces together and they had an answer, and then the patient can go off to the relevant team. Yeah, explaining things well. So that time to talk with your patients and making sure they feel listened to and understood, and they understand the care that you're providing for them as well. Yes, great. Okay. And maybe for the sort of going for a walk one, like just having that pause and getting out of work at lunchtime has a lot of meaning for you too. But as a sort of burnout prevention strategy, I'd really encourage you to identify for yourself what is meaningful to you, and see if you tot it up over the number of days that you work per week. Would you say you're spending 20% or more of your time doing things that are meaningful to you? Okay, so have a think on that. So great, helping people to get better. and a shared understanding of self-care, and it being celebrated with the practice. So I'm hearing sort of that recognition of the work that you do, and the importance of self-care, because absolutely right, if we're here to care for others and to help others, then it's equally, if not more important, to put ourselves on our list and make sure that we've got that time and space and encouragement for self-care ourselves as well. And self-care with each other. Okay, yeah, I like that idea. That's great. Good. So this is the first strategy I've got for burnout prevention, burnout recovery as well. What is meaningful to you? Secondly, I'm doing a non-evidence-based one, lunchtime education with colleagues. Okay, great, yeah. Celebrating your wins on the regular. I think we're often in a society that undervalues celebration and really encourages us to sort of get on and keep going. And personally, I can relate to that. You know, doing an exam and going, right, what's next? And it's sort of like, wait a minute, what happened to the celebration? You got through that exam. That was something that took maybe many months to complete. Great, let's celebrate your achievement. But then how can we also celebrate the little wins on the regular as well? So, you know, maybe that was connecting with a colleague and going for a walk at lunchtime. You synced your lunch times and you're like, come on, let's go and get 10 minutes of fresh air. And who would dispute that that might be a win that you could have with a lunchtime colleague at lunchtime? If you would like to share, as Lauren has suggested, a question here is, what is something you feel proud or happy about? And it doesn't have to be something on the scale of buying a house, having a baby, getting married, passing your fellowship exams, etc., etc. We can look at things that are like, I got a healthy lunch today, or I actually sat down and I connected with my partner for 10 minutes before I did all the other things at home. Like, I often get that there's that second shift and my clients do their clinical work and then they're like straight into things at home. And how can we have that little bit of space and time to ground ourselves? Doesn't need to take that long, 4 to 10 minutes, I reckon, and have some connection with somebody else. So let's look at your resourcefulness. I know you're resourceful people, and I'm sure there's a lot of great things you're doing on the daily. Making clients smile or laugh in sessions. Yeah, great. Running on time, getting home in time for kids' dinner and getting some exercise. Fantastic. Yeah, great. So yeah, there's lots of different things that feel like a win for you as well. Okay, yeah, connecting with others. Yeah, fantastic. Great. And maybe having a teaching moment, but just sort of, I'm hearing sort of time and reactions from others as well, connection with others, having that space to have a laugh and have a memorable connection with that patient who you may have just met or you may have known through the years. Great. Okay, so that's a thing that you could do every single day, and I encourage you to spend a moment thinking about what are achievements that you're proud of, what are you feeling happy about, blocking out more time in your diary to catch up. Does that mean catching up with other friends, or does that mean catching up with admin? But yeah, blocking out some time in your diary is great. So I encourage you from this call, okay, great. So catching up on that admin so it doesn't catch up with you maybe out of work hours. Think about what you can celebrate. And is there somebody you'd like to celebrate with? Is there somebody who, you know, you'd love to share your wins with? Because, you know, it can be something different to talk about to what you were talking about before, and it just can bring that feeling within you again of what you're proud of or what you're happy with. Okay, so that one's free and easy, and something that I do often and my clients love doing as well. Thirdly, we've got asking for help. So I think this is a really important area to definitely talk about. There can be stigma around asking for help. It can be seen as a vulnerability or a weakness. And I like to encourage a very, certainly in my coaching sessions, a safe space. And when I do presentations as well, I look to create that space. Thinking about who you would go to if you wanted to ask for help. I hope everybody on this call does have their own general practitioner. That's really important as well. Let's recognise that we're all humans in this healthcare system, and we need help as well sometimes too. So there's no questions about this one in the chat box, but yeah, I'm just really encouraging you to ask for help. And I'm going to wrap up this burnout recovery strategies for you. And I just want to name the 4 evidence-based burnout recovery strategies you might consider. This is from the work by Prof. Gordon Parker. So first of all, exercise. So we know that when we have that workplace that is the stressor that creates a sense of stress in us, one of the easiest ways to discharge stress is to move. However that looks for you, whether that's dancing, whether that's going for a walk, whether that's going to a gym class, but certainly exercise is a great way to discharge that stress from your body. Other ways are to do deep breathing, to connect with others, have a laugh, have a cry as well, do something with creative expression. The 2 of the other evidence-based ones are meditation and mindfulness. So with my clients, I often encourage them to do a 5-sense mindfulness moment. So that might be, what can I touch? What am I aware of is touching my skin? What can I see? What can I hear? What can I smell? And what can I taste? And that can be a really easy go-to that will just ground you in the moment and get you present and thinking about your 5 senses rather than, you know, going into a worry zone or ruminating on something, or that sort of sense of overwhelm that people have so often. So we've got mindfulness, meditation as well. There may be meditation apps that you like to use. It might be something that you've already looked into before and feel quite comfortable around. And the final evidence-based tool is actually coaching, which has been researched in the US. And they've done 6-month group coaching programs in female residents. So that means in-hospital doctors at a registrar level. They did an RCT and they compared weekly group coaching sessions with sort of no psychology or maybe some paper, not even workbooks, but just sort of paper-based resources for the control group. And they found a statistically significant reduction in emotional exhaustion in the 6-month group coaching program compared with the control. There was also a reduction in imposter syndrome symptoms as well in that group. So that was Tyra Feinstad et al. And I met that crew in America when I went to Austin, or when I went to Texas, San Antonio, Texas last year for the Physician Coach Summit over there. Really great to see that data coming out. There was a smaller study, a pilot RCT in 88 doctors in 2019, which also showed a reduction in overall symptoms of burnout and an improvement in quality of life and resilience by Derby et al., who've done a lot of research in this area. So it's interesting that in burnout recovery research, most of the evidence for coaching is actually in doctors, and there's a huge network in the US of coaching for doctors, coaching for institutions. Better Together is the name of some of the big institutions out there. And I am part of a growing collective in Australia of doctors who are coaches who coach doctors. So stay tuned. We're sort of putting ourselves together and getting ourselves out there. Okay, so I am closing out on my presentation for this evening. What I've gone through tonight is what burnout looks like. So remembering those physical, emotional and behavioural symptoms, those 5 most common symptoms you might notice in somebody coming into burnout. We've looked at the contributing factors, the workplace, the personality traits and the lifestyle factors that can contribute to the risk of burnout in somebody. We've shared 2 different ways to assess burnout, and I've given you sort of one resource that's available straight away, and the second one is in the book by Professor Gordon Parker. And I've given you a whole range of probably 8 to 10 burnout recovery tools, because really burnout recovery is about self-directed management or self-management. There's no one size fits all. We would need to be looking at the work triggers, the personality drivers and stress reduction strategies in an individual. I really believe and I see that burnout recovery is definitely possible in an individual, and that often there's a bit of a shift in identity also, and that's an area that I work on with my clients too, in sort of who you are and not shifting out of your role necessarily. I don't think that quitting is the answer, but people show up slightly differently so that risk of burnout as a reason to and a contributing factor, so that risk of burnout decreases for them. So to sort of tailor in with this being a learning session and upskilling, I would love if anybody would like to share takeaways that you might have from this presentation tonight. Has this presentation invited you to make any changes? And if so, why is it important to make this change? What will happen if you do not make a change? And what will be the flow-on effects if you do make a change? So we know there can be a real ripple effect of making change. Sometimes it can feel like you anticipate, you could anticipate there's going to be discomfort with making change, but sometimes it's really worth it. Sometimes it's worth just like testing out what that's like and actually what's on the other side of that. So thanks for sharing that you're going to take away celebrating the small wins. That's great. Yes, I can repeat the name of the person coming to present in Sydney in September. I can type that in here. It's Dr. Tate Shanafelt, and he's doing the organisational workplace wellbeing. And that is at the ICC in Darling Harbour in Sydney. It's a one-day event. Yeah, so yeah, keep going with any takeaways that you've got from this evening. I know you've got a feedback form to do as well, but if you want to name what changes you want to make and why you want to make them, that would be great to hear that. Okay, exercise, yeah, sure, yeah, fantastic. Organising more lunchtime education sessions, celebrating more birthdays, yes, and work anniversaries of work colleagues, fantastic. That's great. Yeah, we have all the birthdays written down in my brain injury team. There's about 9 or 10 of us in the team, and yeah, that's a real highlight. And there's a bunch of May babies, so we have a really big May together. Love that. And work anniversaries, that's a great idea too. Going to yoga and meditations, wonderful. Yeah, thanks for sharing these, guys. It's great to hear what your takeaways are and what the changes are that you are looking at doing. Great. So I am just going to give you some resources here and communicate to your colleagues what your commitment is. Yes, so a commitment shared means people will be curious about how you're going with it and be backing you on the change that you're making, and you're demonstrating to them that you want to make this change going forwards. I've got a few numbers here. That you might want to make note of if you need to call. These numbers are all available here in Australia. The last thing that I've included is the How We Feel app. So this is a lovely app that is completely free. It's made available by volunteer donations, and it's got a whole range of feelings. So when we know how to describe our emotions with more granularity. So that means more describing words for our emotions. It's linked to better well-being, and that's evidence-based by Lisa, she's written a book called How Emotions Are Made. And so that's an app you can just find on the App Store, completely free. And it's also got some great little bite-sized, very short videos as well, where you can learn a bit more about sort of how to deal with stress and how to process your emotions and so forth. So highly rate that. I've got no affiliation to that at all. It's just something I share with my clients and is useful. And my final slide is how you can stay in touch with me. If you'd like to stay in touch, I do have a podcast. I've been doing that for over 6 months now. Those drop every week. I have a range of wonderful guests that come on my podcast, including some real leaders in workplace wellbeing here in Australia, as well as further afield. And I do a bunch of solo episodes as well, which are on topics such as what I've been talking about today. I'm going to go into the Q&A now and just see what we've got here. Would you recommend having a break from the role? So I'm going to answer that live for you. Look, I think definitely having a break from your role can have certainly short-term benefits, but my caution around that would be, if you go back into a workplace and you bring back the same mindset of how you've done work before and how you showed up and how your availability is and how your boundaries are or are not, how your self-compassion is or is not, the risk of sliding into burnout or the risk of the burnout cycle coming around again, I would say is more likely rather than less likely if you've done some mindset management. And that's what I aim to upskill my clients with coaching, because I think in healthcare, that's maybe an area that we're not necessarily upskilled in. So we're very devoted to our job. We've got a very giving role in what we do for our clients. And sometimes we can put ourselves way down the list, if at all. So looking into what have been some of those triggers that do not involve the workplace while you're having a break and addressing them, that could be a great idea. Okay, thanks for your shares here, reflecting more on what went well and the positive qualities in myself and others. So that maybe is a bit of feedback on some of your takeaways. So great, go for that and spend a little bit of that reflection time on what's gone well and the positive qualities in yourself and others. Okay, Lauren's just let us know. I'm very happy for any questions to be asked in the Q&A. Please let me know if there's more questions around burnout that you'd like to ask. Here we go. Okay. So, other resources that I would also mention, this is a really great book. I can put it in the chat. This is called Burnout, and it's written by two fabulous sisters called Emily and Amelia Nagoski. And it's a really, really great book with lots of stories woven into it. And you can see how they share their ways of solving the stress cycle through there's like one central character that keeps coming back into each chapter. So I'll share that one. And then I've mentioned the other one, Burnout by Professor Gordon Parker. Yeah, please keep coming with the questions if you like. We've certainly got another 10 minutes available here to connect together. And if you've got any further questions, be really happy to answer them for you.
Hi, Jo. There's a question in the Q&A.
So I've repeated the name of the person coming to present in Sydney. I put that in the chat. So I can put it in the Q&A if that helps. It's Dr. Tate Shanafelt. Is that the one you meant?
Oh, there was just a
Another
question
one. Sorry.
about
Oh, yeah.
workplace
Okay.
anxiety.
Sorry, I missed that. Yeah. Is workplace anxiety part of burnout? Yeah, interesting. So I might need to know a little bit more about what the anxiety is triggered by. I guess it's by the workplace. What are the specifics around being in the workplace? I would say anxiety could be part of burnout when you maybe have some lack of clarity around your role. Anxiety can be some of the flip side of, or can be partly tied in with that resentment part where you're not really sure about sort of what's, how do I best explain this? I would say it could be. I wouldn't say anxiety is necessarily one of the screening questions that I use in my burnout questionnaire, but yeah, it could be. It's such a broad spectrum of symptoms that we might have in an individual getting burnout. Here come the questions. Okay, so any tips on approaching do you think it might be burnout with employees who don't recognize it in themselves? Okay. So I'm hearing that you're probably in an employee role. So I think you could suggest a burnout assessment tool if you'd like to do that. It's something that's sort of a neutral space to assess what might be going on with them. You can look into what might be the workplace stressors or triggers for them. You know, see what you think their personality traits are, see how their self-care is going for that with themselves. I guess setting up a check-in and then saying, well, let's have another check-in in 2 or 4 weeks and sort of see how things are going then, because unless it's really addressed, I don't see burnout necessarily going away on its own. Got another question here. Do we feel that early career health professionals are at a higher risk of burnout? I think it comes in waves, you know, so it can, I mean, it certainly can even happen in medical school. We've got data that up to 50% of medical students experience some burnout, and you may well do some teaching also to medical students. I have seen sort of the syllabus load that medical students seem to have now compared to when I went through medical school, which sure was a while ago, and we, you know, didn't have so much online by any means, but we see that yes, in medical students it can happen. Also, I would say some of the clients I've worked with in group coaching in hospital, they're often on the earlier side, they're pre-fellowship, and there's certainly quite a sense that some of them are burnt out. Probably they've come through burnout through their years, at least 50%, I would say there. And then I think there's more later on. Most of my clients are sort of 40 to 55. They've done all their exams and they've got children, and there's the juggle of sort of caring at home and then giving and turning up at work as well. So I would say there's another peak then. And I think there's also a bit of a peak sort of later on towards retirement age as well, as people determine what that is for them. So it can be throughout our careers, really. I think it would just be my sort of anecdotes and my observations of what I've noticed through working with career or health professionals through different stages of their careers. Any connection between burnout and bullying and harassment? Yeah, good question. I would say that could tie in with some of the psychosocial workplace risk factors. So not feeling safe at work, I guess that sort of certainly shows up in somebody who's experiencing bullying and harassment. So that may well be a stressor in the workplace. How is that individual trying to get away, or what is their safety? Where can they get away from that situation? I would say yes, that could definitely be an issue there. Now, we've got one here. Do you have any general advice for sole practitioners who show signs of burnout? There is not exactly a team around to share the load or celebrate the wins. Okay, great question. So I guess we can look at these sort of workplace factors, and you've probably got more autonomy on your workplace than if you were an employee. So you may have more ease, but also sort of you're running the show as well, I guess. You've got to work out what is the best sort of balance of number of hours that you are in the workplace. Think about also your lifestyle factors. So if you don't have other fellow practitioners in the workplace with you, who are you connecting with on a regular basis? So who is your support person? Who is it you go to? And then think about what are your personality traits that you've got as well. Are you very high achieving? Do you have reasonable or unreasonable standards for your work? And are you a perfectionist? Some of those areas that I've talked about before around sort of personality traits. So who can you celebrate the wins with? Well, I mean, even just starting with yourself, even starting by journaling maybe or writing down 3 wins that you have for the day. By a week, by 30 days, you'd have almost 100 wins that you would have identified through 30 days if you wanted to commit to something like that. And that might feel quite different to not having started with celebrating the wins. So I would say I would encourage the sole practitioner to have other people to connect with, whether they're related to healthcare professionals or completely separate, but somebody that you've got to talk to and connect with there. Okay. So lots of great questions that everybody's asked there. Thank you so much. Yes, I'm glad that's relatable. I don't want to forget about you sole practitioners. I'm a sole practitioner when I do coaching as well, and I totally get that as well. It can be like a lonely spot on your own for a while, and seeking out connection with others is such a vital part of our human condition of who we are there. Everybody, thank you so much for your time. We're closing out on the hour now. I hope this has been a helpful evening talk for you. It's been my absolute pleasure to be the guest expert. And if you've got any questions, please reach out to me through my website, on social media, etc., etc. I'd be really happy to answer any of your questions privately.